So, do we have, I guess we can run through new business that doesn't need to have approval as an FYI, if that sounds okay.
Wait on minutes for next.
Yeah. Okay, good. All right. So I will send out electronically as well, but I have an updated Health First Indiana budget. You might remember that I had some additional funds based on the number of counties that enrolled into the program. The state was waiting to see how many came in, and then for those that did not, they equally distributed that money out to the counties. So when I sent that email out to see how we would like to appropriate those into this Health First Indiana budget, I got feedback regarding some trauma and injury prevention, which is a core service, to have the addition of bike helmets. So I did add bike helmets, and then Doc had suggested maybe some counseling, but that wasn't part of like what we could spend the money on. And I had talked to Mike. So what I did was I distributed the balance, which wasn't a whole lot, across marketing and advertising, more life jackets, more car seats, more glucometers and strips. So I just distributed the money across what the board had already approved in the budget. I had also just double checked with the council, because this would technically not be appropriated from the budget hearing. These are additional funds. And I was advised that that's fine. That's not a lot of money. It's already, and we had these additional, so we would just need to account for that. So all of that was settled. Now, the budget that they have before them, Mary Jo, has all the lines removed just so I could print it in a legible format of what we did not put in there for expenditure. So there's lines that we didn't utilize, like for capital, bricks and mortar, and those kinds of things. So I will send that out to you guys electronically. I will try to do that tomorrow morning. Angela says yes, sorry. And we'll see if she comes in. And that way, everything is transparently communicated about where the distribution of funding is. So just going on about the update in the budget, the state has put on regional workshops. I did attend the one at Putnam County and networked with some of the other health departments, and we talked about their initiatives. One of the things that we're going to need to do in early 2024 is to establish our key process indicators, which means the key process indicators are already established by the state around the core services. So you might remember early in our planning discussions, there was a 60% of shall and a 40% of shall, but the funding distribution was 60% to 40%. But we have to have key process indicators to measure our success for each one. I believe that based on my networking and attending the state LHD meetings that have been offered, that we will need to work together as the health office, the health department office, as well as our formed subcommittee, to be able to establish what those goals look like to bring back to the board in February, because these funds become eligible for us to draw down in January. And so we will have that, I believe that'll be our next board meeting, will be February. And that way we can have our roadmap on our success as we build out our plan to measure that for the state. That's not a possible thing. It's a you shall thing as part of this funding. Okay. The next things that we would want to say as far as this funding, that very early in quarter one, starting in January, we will need to start purchasing the equipment, meaning the Colestech machine, the lead point of care testing, and some of the supplies, including the glucometer, and some of the other pieces that are listed in the budget before you. It will be key that we understand what the lead time is on our testing, because we will need to add the lead, point of care testing, and the Colestechs to our CLIA. So you might remember, Liddy, when we had to do that for the swab, for the Binax Nows. We will need to dust off that shelf and say, what process did we go through with that?
Which we still have our CLIA.
Yes.
I suppose we just need to
Add it.
Okay.
Yeah.
It's just a written request.
Yep.
I had to add to ours, and it was a written request on letterhead.
Yeah.
They don't update your actual CLIA, though, until you have to reapply.
Yeah. So we will have to do that, and that will be contingent upon receiving the testing supplies and that. So once we have that, we can get that going. So we did meet as a small subcommittee around the chronic disease management to understand what the group felt about how we could have the biggest impact for the population. And so what we are doing is we are coming up with a calendar, if you will, to be able to offer 2 offerings, right, per quarter for the locations around the county. The subcommittee felt that pairing our activities with already planned events was a way to have a draw of the population. So, for example, through Partnership Parke County and some other of our partners, we know that Main Street's going to be here, or the Bridgeton Days are going to be here, so we kind of have an idea of the logistical pieces of that. On the tail of that, then, the state just offered a chronic disease management webinar about, you know, all of the given rural county data and our disparities and the social determinants of health. And what I took away from that was I felt very good about where we're starting in terms of surveillance and providing information and connecting patients to available access points in the community based on where they live, and also being able to give them supplies if we do find that they do have an exponentially high blood sugar, to be able to get those things started. We're not going to be able to solve everybody's needs, but we're going to be able to draw attention and recognition through knowing if we have patients within or people within our community that are suffering from the chronic diseases that we're targeting here. Then the trauma, injury, and prevention component will be much more layered in towards key dates associated with Roundup, with summer safety, life jackets, helmets. Now that we have the Parke County Fair dates, National Night Out. And so instead of working harder, we're trying to work smarter based on the recommendations to go where the population is. And already going to be, and congregating, and how we can get out knowledge, information. And I did feel from our last National Night Out before this funding started, we really did have a good turnout and interest among our population.
Putnam County said they were amazed at how many people actually had their kids get vaccines. Of course, they have that trailer, but even a pop-up, or if nothing else, make appointments to get them.
Yeah. So I think that there's a lot to be said about the chronic disease portion and where we're heading with that. I would say that I did find a member to join the subcommittee from Hamilton Center, and then Heck from Valley, Angela, for behavioral health components. And maybe they wouldn't have to attend all the subcommittee meetings that are being set, but they would be ad hocing in as certain topics came up into the community around those specific pieces. So, the lion's share of the work is the first forming of the team, organizing the plan, and then deploying the resources. So I feel really solid with where we are going to be able to kickstart getting the equipment in January, getting the CLIA up, testing the equipment, and then being able to do our first, hopefully with all that, maybe it's all back ordered, but with our first pop-up in March. That'll be the plan. Because that's kind of when the season starts off with the Maple Syrup Festival and having something at the fairgrounds and being able to go where the population density is. But our target is still going to be in the targeted communities of Marshall, Bridgeton, Rosedale, Lyford, Belmore, Bloomingdale, so that we're going out and helping folks overcome the barriers. Julie was also able to make contact with the Amish community, so we will have representation from that population segment around that. So
Health and Human Services, Beth, she's gonna be on the subcommittee as well. She agreed, so
yeah,
we'll have her and her resources available.
So that's kind of the status of our core initiatives that we as the board put forth and decided upon how we could get there and when. Now, there has to be, when I talked about the key process indicators, even though we may not be getting funding around tattoo parlors and eyelashes, we still have to have KPIs around that. And that may be, and that's why I said we're going to have to meet as a health department, not in a board meeting, to find out, do we partner with somebody?
And the first thing is the county has to get an ordinance. Right now, they don't have an ordinance. The town does. So like I checked over at Thompson's for their estheticians, because the town has the ordinance, so we can't really do a lot until
Right.
the county.
So that's where
I've spoken to Nick about.
Yeah, so I think that that's where, as a group, we've got to come together and decide what pieces of the puzzle we miss. Are there pieces of the puzzle that we need to borrow from over here? Or, like tobacco cessation, we're going to be on the hook for that. And one of my regional meetings, I found that I believe it is Mental Health America receives the tobacco dollars for our county. So where are those monies and where is that support coming in, and how do we understand what our cessation work needs to be and how that money flows, I'm not sure. So that was one of the things that a lot of the health departments had questions about at the regional meeting, because there's a key player that's in a region that gets the money, but then a lot of the counties didn't know where the money actually was seated. And some reflected upon years past when there was like blue packets that people were able to come in and grab that had cessation materials and the gums and the Nicorette and things like that.
First few years I was here, I can't tell you how many people came in wanting that.
So, and then according to the other health departments in the region, that went away, and we're not exactly sure. So those are some of the offline conversations that we need to have as we gear up for getting a submission to the state around this grant for the key process indicators. So, do you have anything to add, or Sandy, anything to add from kind of what we talked about with chronic disease, trauma injury prevention?
They did offer yesterday, during that the state put on, they offered, and I think she said they're going to email everything out next week, but they offered several different programs that they're already they already have, that the state offers, that if we determine through the testing that somebody needs to follow up and they're either homebound or they're not willing to go out or they don't have a primary care provider, we can refer them to these programs, and that counts as our HFI, as the KPIs for the HFI funding. So that's hugely beneficial to be able to at least get them access to more information and meal planning and, different sides of things that we maybe don't offer.
Yeah, I think that's really good information there. There's a lot of resources and tools coming from the state level. And I would say that this year one is really us gearing up and understanding as we get out into these communities and start surveilling chronic disease and needs around vaccinations and trauma injury prevention. We're going to learn a lot. But again, I wanted to make focus that we have to focus on the entirety of the 4060 for our KPI discussion, not just what's funding. So there's a little bit of work and Elmo Grease we're going to have to put in January for board approval in February, I would say. So
we're planning our first subcommittee meeting January 17th. So
yeah. So we've got good things coming in on that. And so that doesn't need action, but I will pause to see if there's any questions.
I have a question. I just note that the initial amount for the ambulance service for EMS in the first budget had been $104,000.
It shouldn't have changed.
Well, now it says 104,410.
It was this. It should be the same monies that was allocated and appropriated because I didn't add or subtract any money from the ambulance service budget. All of it went to supplies.
Okay. So my question is then, if that is the amount, and if we have 2 events for
Per quarter.
2 events per quarter for chronic disease, and 2 events for trauma and injury prevention, that would be like 4 events per quarter. That'd be 16 a year. That comes to $6,525.63 per event. If each event is 4 hours long, you're looking at $1,631.41 per hour. If 4 people from the ambulance service are helping out with that, we're paying $407.85 per person per hour. Is that?
No, that's not reflective. And actually, the entirety of the contract with the ambulance service is also the planning, the organizing, the subcommittee, all of those things. Like you would be administering a contract with, like, say, Union Health for the delivery of. So it's much more than just the events. There will be personnel that will be assisting with the events because they have the skill sets to be able to do the blood pressures, the glucose tests, the cholesterol, and those things, because with only having this many people in the health department, it really doesn't lend itself for us to be at that many events. The trauma and injury prevention, I want to clarify, will only be in those spaces where the population density resonates with that cause. So if it's a kindergarten roundup, if it's something special with the school, if it's something with, say, examples, things that are occurring within the local community of Main Street, or things where kids would be there, that is where we probably would aim those resources. If we want to do something planning-wise for suicide prevention and recognition, then that would be for us to discuss in that, because we did talk about that with trauma injury prevention when we looked at our initial health statistics and where Parke County ranks very, very high in the state. So that would be then putting resources towards maybe the walk again, because Liddy reflected about how well received that was within the community, and that was, I think, more of a latter start of autumn event. So that would be planning for September. And then we would partner with the subcommittee members to say, hey, let's bring mental health resources. Let's do those things. So a lot of this is at the organic phase right now of development. And that's what I said with we've got to get the supplies in, and then we have to look at the calendar of events where the populations will be most dense at the times in which they exist, so that we can plan and organize and advertise. Advertise is the key, so that we can have the biggest impact for the community.
And then there, I'm assuming, which you're not supposed to do, there'll be like people that are certified for the car seat safety, or somebody's going to speak as to water
Exactly.
safety and that kind of thing.
Exactly. Exactly.
I was going to ask whether there's training that needs to happen for those things.
No. So while I appreciate the point and the math, again, that's why we have the subcommittee. And as I said, these things just don't happen. We've got to put a lot of elbow grease behind it, and we have to have the work of the health department to help influence. Because again, I heard a lot of positive about the suicide walk. That's going to be a key metric, you know, not in our KPIs, but around trauma, injury, and prevention that we can at least draw awareness to, you know. So those things are developing. We only had enough information to go on right now because calendars are still in progress. Would you say that to be true?
Absolutely,
Yeah.
yeah. I'm still every day getting messages about events, so it's going to be, I think we're going to be well into the second quarter before we get a good grip on the calendars.
So I would also say that one of the questions that I have asked that we will need to make a decision on from a health board perspective to action on is who do we utilize for our graphic design and our advertisements so it's eye-catching and draws in information, and do we do mailers, and how do, you know, we've got to operationalize our social media pages to have the biggest penetration of knowledge out to the community. So that that media and advertising piece will be key to also helping people have expectations of what events are going to have which services. Because when it's cold out, there may just be indoor testing and things like that. But as we get more towards the summer months or when kids are going back to school, it's going to help shape our focus.
And Lord knows there are plenty of events in Parke County. I guess my question / concern is, I know it was mentioned like fish fries or, you know, spaghetti dinner. Do you think people want to get their cholesterol checked when they're eating?
We had that conversation, and the committee felt that initially we were going to go where the people are. So, you know, it's just like with the fair and National Night Out, you know, people don't typically combine the fair with health screenings and immunizations and things like that. But I think that what the subcommittee, and correct me if I'm wrong, said is that you may draw additional people through advertisement and knowledge that these things will be set up at this co-location. It's not that we're going to try to grab people grabbing their sandwiches. We're going to advertise co-locating services.
I just don't think we should advertise for a fish fry or something of that nature, because
Of course.
I know my own self personally. I don't want to go somewhere and then go get my cholesterol checked at the same time I'm eating.
You're
I'm
right.
National Night Out, you know, if there's a booth, but I mean, people don't necessarily do that like at the, you know, area fish fries or things like that. I mean,
It's not
they're there
necessarily
to visit with everybody. Not
I
necessarily.
mean, the other thing to keep in mind about that is that it's going to falsely elevate the, at least triglycerides, if not the other cholesterol.
Yeah.
I'll let Julie speak to that. She's sitting in the back and she's a little hoarse right now, but I'll let her speak.
So we're not targeting fish fries. We're targeting
Population.
populations. So when I first sent out the request to all 9 fire departments, because I wanted to make sure that we could use their facilities or use their community center, because some have a community center and some don't. But that gets us, if we go to the 9 fire departments, that gets us into all the townships. So every small community within the county. And of course, one thing that they do is dinners. That's what fire departments are known for. And so when I first started building the calendar, those are the first things that came back. Like, hey, here's our fish fries that we have to schedule a year in advance. Here's our pork chop dinner and chicken dinner that we have to schedule a year in advance. But also.
So are we gonna tell them all the fast before they go?
No, what?
No, there are other events that are
Check
happening.
it before they eat the fish.
Yeah, there are other events that are happening too. So those are just the first responses that I got. But now I'm getting like, Bridgeton has a country Christmas program that they put on that's a small shopping event. Bloomingdale has
like that would be more appropriate.
Yeah.
Yeah. So I'm just trying right now to build the calendar of what community events we have, and the first community events that came back were fish fries. We're not targeting fish fries. That's just what came back first.
Yeah.
So there are several.
There's, like you said, the element of go where the people are, and it might be a good opportunity to talk about, hey, how much do you eat fried fish?
I like the way you think, Angela, and I think that to just add to Mary Jo's earlier point, we would never co-advertise a fish fry. We would say that we're offering whatever X, Y, and Z services to the community at X, Y, and date in this location. There may be people that come specifically for that aren't fish fry goers, but there may be fish fry goers who have kids that want to get their lead checked. I don't know. So it's very organic and symbiotic of where the population goes. And so, Julie was saying that she's combing for events that are going to occur through the 2024 calendar, and so far those eating things are the ones that have come back.
That's what we do in Parke County.
Well, and apparently Jonah is booked out years in advance, and so everybody knows their Jonah dates because they're booked out years in advance, so they have to set them every year, or they have to set them every 2 years or something. So that was, the fire chiefs knew that right off the top of their head. So, I mean, I'm going through, like, we don't have the Main Street dates yet. There's 3 car shows that typically come to the county that draw decent crowds, that have vendor spaces.
There's one there's a couple down at the park.
Yeah.
And so they don't have the dates for those yet. The one in Montezuma, they said they don't usually set it until like a month before. So
We may be scrambling on some.
Yeah, some of them we might be, but they know it's in the month of May usually, so I've gotten some of those, but yeah, I'm trying to figure out where the best crowds are going to be, and also it's kind of like putting puzzle pieces together to make sure that you hit each community. Like, really, you probably want to hit the Belmore area during early summertime, so that we can do our life jackets and some of our injury prevention out there, because that's the biggest area that we see boating accidents.
And Rockville
And
Lake,
drownings,
and
yeah.
So it all has to be very coordinated, and that's where, with the contract to the service, is that we have somebody that's helping to coordinate these things and looking at the resources of, does it lend itself towards chronic disease management surveillance, or does it lend itself more towards a trauma injury prevention, vaccination, those things. So, it's not a one-size-fits-all approach at all.
And just to keep in mind, Brian from Putnam County, they spent so much money on their trailer. Did you see it when you were over there?
Unless it was in the parking lot, I didn't notice.
Okay, she looked over a little bit further, but I mean, it's huge. You could do a mass vax clinic even during the fair or National Night Out. He's always offered it to all of us.
Oh, nice. Liddy was saying that Putnam might be able to share like their mobile trailer that they offer vaccines in at different events. So that might be a collaborative opportunity for those on the phone. Any other questions?
Sounds good.
Okay. Any other questions? Okay. The only other thing that I had for discussion and non-actionable, and then we'll go up to the approval and signing of the minutes for first quarter, and the special GPHC funding from 727, is Senate Bill Enrolled Act number 4, and I will email this out tomorrow. Take one and pass it around. What I have, girls, on the phone is the Senate Enrolled Act that shows the changes the changes to local public health department and related legislation. Do you have one?
I don't need one.
Okay. Do you have one? Okay. So this has the strike through of what was redacted. It has the bolding of what has changed. And this is really something that, you know, as we had talked about with our board orientation, it's really important to have, and I don't expect to talk through this tonight, but to be really able to understand. Janet had mentioned about the change in the composition of the board and the subsequent terming out, and got the answer that when the terms occur, then we need to go into this model of the Senate Bill 4. But as I had also stated, there is a requirement around an annual report that used to be in the legislation as a published pamphlet, which is no longer in legislation as a published pamphlet. It is a submission, and it is subscriptive in here as to what needs to be submitted on behalf of the local health department to the state. So the state has the items, and so no action today, but I think that that's another kind of internal meeting about, you know, what do we submit and how does it go and all those things. And then secondly, we need to probably make sure that we're drawing our attention, and Janet does a wonderful job keeping track of the terms. And so that way, you know, we still have to maintain the political balance of the board. So then when we know these forecasting things are coming, we're going to need to know what our pool of replacement submissions to the commissioners for consideration needs to look like. And then we also have one that needs to come from recommendation of the town of Rockville because it's the largest population density. And then we also have the council. So just wanted to make sure that that was back on everybody's radar. And I didn't really get a date because I was in that meeting last week as to when we had to have that submitted by and if that was going to be a red cap thing for the annual report or not.
I bet it will be. It has in the past. Either that or the state will send out a template
Yeah.
to be done.
And in that meeting with the State Board of Accounts, we probably need to have an internal conversation as well, which will need to be actioned by the board, probably on our February agenda, about our two other 1206 and the 1168, because a lot of the counties and what they're saying from the state is that we really need to spend down those accounts for the appropriate lines in which they were designated for. They really want us to zero those accounts out sooner rather than later because everything's going to the 1161. So for that piece of it, we do need board input and board action. But the state is expecting us probably to get those rendered and zeroed out and spent for the appropriate lines. Just as an FYI. Any questions about Senate Bill 4? And I'll send that out to you, Mary Jo and Angela, and of course Ronnie's not here, and Sharon, just so you guys all have the information that we're talking about. But it's a lot of reading. But I like this version that I sent out because it's redacted of what got pulled out. It's bolded as to what got put in. And the regular text is what stayed the same. So that way it can be a little bit more easily digested. Okay, that's all I had for new business on Health First Indiana and Senate Bill 4 review and discussion. So moving back up to the general business of approval and signing of minutes for the first quarter board meeting on February 9th, and then the special funding meeting on July the 27th. Let's see. Did we have another meeting in May, or did we already approve those minutes?
Yeah, we don't have the minutes yet for May.
Okay.
So.
So, all right.
Well, I mean, they've already been sent out,
Mhm.
so I'm assuming they've been read. I guess we're just seeking approval of the minutes.
Mhm.
So,
Does anybody want to make a motion for approval of the minutes for first quarter, February 9th, and then the special funding on 7/27? And we still are lacking the May minutes, so it would just be for these two sets.
So moved.
She did. Angela first. Anybody want to second that?
Second.
Okay, Mary
I
Jo.
will second.
Okay. Is anybody opposed? All in favor?
aye.
Okay.
So we just need signatures on those. Do you want to sign immediately or once we're done?
I can do it once we're done. Thank you, Janet. Appreciate that. All right. Moving on to our annual health department report. Dr. Swain, health officer report.
Okay, well, I think we have a great team here at our Parke County Health Office. I think they all do a great job. Janet does a fantastic job keeping everything tied together and everything organized for us. And Liddy does a fantastic job with all these inspections. And it's really great how well she did with a record number of dispensers in the Covered Bridge Festival, and plus has inspections due, the food inspections and the installation inspection for septic systems. So she just does a great job of getting all that done. We can't compliment her enough. And Sandy's working hard on our immunization program. So I think things are going real well. I think we're going to have a great team here. And of course we have Stephanie here. Overlooking things, routing things. So I think things are really going good in our health office. Does anybody have any objection or anything to add to it? But I think we're having great problems except trying to keep the finances going, I guess.
Yeah, I think we're in good shape.
Yeah. So I have.
All right. Thank you, Dr. Swain. Liddy, food inspector, sanitarian, and EP report.
I gave you a report if you want to just read it. It could be somewhat loopy from fever.
You can see it in your eyes.
Yeah, that's quite a report. That is the record number of 0.8 per minute. 375, so it looks like the Covered Bridge Fest is growing a little
It
bit.
seems to be, at least the food side.
Yeah. Probably the biggest event in Indiana. So
It is.
Parke County can be proud of that. But, gotta keep it going, and boy, that food inspection is really important, and,
It's a lot.
yeah.
The only question I had is there an annual and I don't know the answer to this, that's why I'm asking. Is there an annual hazardous vulnerability assessment that is completed?
I am working on it. I will get it to you when I get it.
Well, I was just wondering if we, if once we do that, do we draw in additional stakeholders to look at the emergency preparedness plan, or is that just for public health threat? Because
That's what it's, I mean, we have to submit it every year. It basically talks about population and lifespan, that type of thing. And it's really not reflective for Parke County just because we don't have the nursing home or the hospital. So it's not going to reflect the true picture of health in Parke County.
okay. Well, I would just be curious because we do an HVA annually as well, and one of the requirements that my history has shown is that we share that with LAPC, we share that with the local police, and those types of things. So I didn't know what the PHP requirements were
I participate in LAPC.
for communication out to like EMA and EMS and police and all the
EMA a
other
little
keys.
more than EMS. EMS, we don't really have, other than obviously we're partners. She's an ESAF 8 partner, but as far as planning things together, it's more probably EMA,
Okay.
EPC.
All right. Sandy, that leaves you to public health nurse and school liaison report.
So far we've given like 30 COVID shots and 32 flu shots. I have filled out for us to get an NPI number for the health department, but I got it back. I have to resend it because I forgot to get Dr. Swain's signature on it. I missed that part.
Can you tell me again how many shots you gave Sandy?
30 of the COVID and 32 of the flu shots so far. And school liaison right now, we did make sure that they were getting their screenings done, like their oral health and vision and ear. So which the hearing screenings are done by the speech therapist. When after the first of the year, like in January, they're going to start doing vision screenings again. So we're going to help with that. And that's through, I think it's Optimus Club or something does that.
Lions.
Club. Okay, so they're supposed to contact us, and we're going to go help do that. And also, as far as the school goes, they're going to let us after the first of the year. Then the kids going from one grade to the other, like the 9th grade, 8th graders going to high school, things like that. They'll be needing immunizations, and so we're going to get with them on that, so we can get those all up to date. So that's kind of where we're at right now.
And then I sent that link that there was like these free toothbrushes and whatever that was available.
Yeah, and you have to do a plan an event in order to get those.
They said they're looking into that because some other people said the same thing. They don't necessarily have an event plan, so the state's going to try to see if we can.
Yeah. But I thought that would be a good
I signed
thing.
up for it, but like I said, we didn't have an event plan. So, I mean, I think that would be a good idea, and getting the kits together for the kids at school, like toothbrush, toothpaste, deodorant, things like that, so they could give them out to the kids at school. So.
Very good. Janet, clerk registrar report. Thank you.
I will also email these out to
Okay.
everyone. First, the registrar report. To date, we have 73 births and 70 deaths within the county. As far as the clerk report goes, I have listed all the fund balances as of the end of October. Attached, there is, we've had a situation, Liddy hasn't been paid for a number of months there. And I went back to July of last year, just to see where we were at with it. It looks like we were kind of at a relatively a zero situation there that I could start from. And so, if you can't understand my chicken scratches, just let me know. But it looks like probably, when I was asked to request appropriations to that fund for 6 months earlier this year, the problem stemmed from the fact that she had not been paid at that time from 2 months from the year before, just because things kind of run behind with the state depositing, and so I think that's kind of where that runs from, and so you can see where we're at with that right now.
Where are we at with that right now? For the record.
So it appears she has not been paid for May, June, July, and August
This year?
of this
Okay.
year. And we have already received money from the state for those. She has invoiced for September, October, and did you say November, Liddy? She has invoiced for those. We have not received those payments yet.
For which September and what?
September, October, November. She has invoiced. We have not received those payments.
Well, the initial, and I think I sent that out electronically and very transparently, that on behalf of the health board, it was requested for the appropriations, especially for the first 6 months of the year, and then that runs through June.
Correct.
So,
But this year, she was paid for 2 months of last year. So, I mean, that's where the problem lies, is because
It appears that it's whole.
We appropriated for 6 months, right?
right,
But 2 of those were used up in payments from 2022. Because she was paid for, in January of this year, she was paid from November of 22. And then in February, she was paid for December of 22.
so it appears that the 6 months have been sufficed, but it was really the 2 remaining months associated with 2022.
No, I didn't get paid for, Mary Ann said, they said just paid for, they thought I'd been paid for January, February, March, not realizing 2 of those were from the year before. And then Mary Ann said, they said only pay for, what'd she say, May and June, not for April. She said that's what was said. I didn't.
Yeah,
know.
because the health board action clearly was for the first 6 months of appropriation, and then requests would be made to be approved by the health board exceeding a certain dollar amount month over month for submission and authorization to go to the auditor, and then consideration to the council. That's what was action. So
you're saying, regardless of the fact that, I mean,
We need to get Liddy paid.
Agreed.
I mean, she worked the hours, so we need to figure out what we need to do to make sure that happens, whatever process that we need to get done.
agreed. I don't disagree with that, but what was documented and what was requested was the appropriation for 2023 January through June, which was the first 6 months, which was approved. So it sounds like, and again, my processing of what I think I hear is that 2 months from the 2023 first 6 months or 2 quarters was missed because of makeup of 2 previous months being paid in that time period, in that time frame
yes.
from January to May.
Yes.
That's what I'm hearing.
Yes.
Okay. Then subsequent months, what I heard is that September, October, and November, but where is August?
It's
August
it's
is-
in the fund, it just hasn't. They said in the August meeting they were not gonna appropriate anything after June.
What about June and July?
No,
We have received the money for June and July
From the state.
from the state. It has not been paid out.
So we need to get that appropriated to pay out.
So the health board, based on our former board action, those requests need to come through the health board for this body to action on, and then we have our stamp of approval then that goes to the auditor, which then goes to the council, correct?
I think it kind of did, but I think it, just from hearing everybody, what I'm hearing is 2 months were overlooked, and so they retro paid.
Yep.
So we just need to fix what has been retro paid and pay what is actually owed with June and July,
Right.
August, September, October, and go ahead and appropriate the last 2 months.
So,
If we've received the money from the
you
state, then
requested
there should not be an issue. We should be able to appropriate that and pay it properly.
So hey, Mary Jo, and Liddy was just talking here. When I sent that initial email to the question that was sent, and I sent back the documentation of what the health board action, there was the 6 months of January through June at X amount, and
I
then
understand that.
Right, but then, I'm still,
That way, so we need
Right.
to figure it out.
but then I'm still adding on to, I agree. But then Liddy was just saying that additionally in that email, there was the recommendation from the health board for the remainder of the 6 months because of the split of the fiscal year on that particular grant.
And Janet
So-
did submit it.
I agree with you that the 2 months that were overlooked because of the retro payment needs to be addressed. And then secondly, I do believe you're right, Liddy, in that email, then the recommendation of the health board was to put it at what we had approved during our initial budget work for 2024, 24 at that 6 month mark prorated for that. Okay. Is that what you guys understand on the call?
I'm pretty sure.
Okay.
Yes, I believe so.
Okay.
So my question is, because what was requested as an additional as an appropriation early in the year was designated as January through June,
Right.
when what ended up being missing were November and December from the year before. Is that what we need to call if we were to appropriate that? Do we need to call that November and December of 22 rather than May and June of 23?
Yeah, my thought process from an account and finance perspective, and I'm interested in hearing, especially Mary Jo's thoughts on this from being in a county held office before, is that we need to call it what it is. So what I'm hearing in my mind, again, is that payment was rendered for November, December.
Yes.
We were missing 2023 months in the first 6 months. But
Yes.
what it looks like is that all months were accounted for, but it's not.
Except one, which Mary Ann said they only said
Correct.
to appropriate May and June
And
and not
we-
April.
We need to make
I
sure
have
we're
it all
paying her
worked
for
out.
what she was getting paid for
Let's do it
at
with
that
fine-tooth
time.
Right.
Because we then, in our budget meeting, decided to take that down a notch. So whatever she was being paid for prior is what she needs to be paid for.
Right, because that's what all was sent out to the board and
Right.
to the council.
And that's what was her wage was at that time before it was reduced.
So where does the hiccup lie at this point? I mean, I understand the months, but where is the remedy?
The remedy is,
We need to make sure it gets appropriated by the council to pay
Yes.
for those months.
which I think will happen come 2024 because we turn that in with the budget. Am I right? I mean,
It
think
was
will be
submitted.
less of an issue.
But not when they said they were not going to appropriate it.
It needed to run through the approval of the health board, is what I understood. Right? Is that what you
I
understood?
just think that we need to make a request to the council for appropriation for those because one, it's been appropriated by the state for that specific, fund for what that fund is, Liddy is being paid out of. And have that additional if it has to be appropriated by the council, then it has to have that additional appropriation, but they need to understand that is for work that has already been done, and, we can say it was an oversight on whoever's, the health board, whatever, but we need to do that appropriation so that she gets paid.
In my mind, it was clearly communicated.
You was,
If we do
that's
not
what
pay
you
her for
requested, and you
services
said
rendered
the board
for doing her
requested
job.
that they did January through June.
Because it was two
and then
different
to
amounts.
Go ahead and appropriate the X amount.
Yeah.
For July through December, because there's,
It was a difference in how the fiscal year ran for that
Yes.
particular grant.
yes.
I don't think the money changes until January 1, 2024.
No, it changed.
No, it
to
changed.
July 1.
It changed.
So I think her money should still be the same as what it has been until January 1.
It changed July 1, Liddy was saying, Mary Jo, because that grant cycle is different.
It runs
Okay.
July 1 through June 30th of the next year. Which makes
Okay.
sense even more.
All right.
So it throws it off our fiscal calendar.
So they run from July to June, as to where the county runs from January to December.
Correct.
I think there is an issue that the state is sometimes lagging behind as far as payments go, you know, and the county is not willing to pay unless the money's there, kind of thing. And
This
it
is, it's
can
supposed to
throw
be,
it off kilter.
it's written as a reimbursable grant.
I'm gonna pause for a second. I gotta check on my child in the gym.
Check on mine too, would you? They're at basketball practice. Yeah.
So it sounds like the health board has submitted what is necessary. The action of that is where there's the,
So do I just need to approach Mary Ann again and
well, I mean, I'm more than happy then on behalf of the board to resubmit the initial request and correspondence that all of you know back out to the council and CC Mary Ann if you think that that would help steer conversation.
Because Mary Ann got in trouble for paying me, I think, in January and February, even though it was for November and December. And in the August meeting, she said, we are not appropriating anything after June. Do not pay her if it is not appropriate.
So conversations need to happen. Anything else on your report, Janet?
Yes. We actually have, I'm sorry, I was making notes on that. We also have a fund now called the 8175 Immunization and Vaccine Child COVID. At any rate, it also, it's the attachments A and B for that I have included. It's attached to the agenda, the clerk registrar report. It is from July of this year to June of next year. I had ignored it because I was not even sure we would be able to accomplish it, I gotta say. Because when it came up and they were wanting us to sign up for this, we had a health officer that was having heart surgery and a public health nurse that was not around much. And we are just now able to offer children's vaccines. At any rate, this is $20,485.05 to be used for vaccinations. Attachment A shows what needs to happen with that. Attachment B is the budget, which was a suggested budget by the state, which I said, fine, whatever, go ahead, because I don't know what we need. So this is what they suggested and I approved. And if we need to make changes to that, perhaps I can reach out and make changes to that budget, but we need to get it appropriated and used by the end of June.
Did you have input into this budget since it's for childhood vaccines?
Did I have input? I basically, I mean, this is the one that Dr. Swain wanted us, he thought we should go ahead and get. At the time, we didn't even have approval for childhood vaccines. But, I mean, we do have them now, so I mean, I think, we could use the money and hold some clinics and, try to get these, try to get all the kids we can immunized. I mean, as far as the monies, I mean, I don't know. I mean, I don't know what, mean, I don't know what personnel money is for, I don't know what, I mean.
Yeah, I don't know either.
Which you can, I mean, obviously you could move it from one line to the other.
Can you? And do you reach out to them first and, yeah, okay. I don't know that we would need that much in personnel at all, you know, because it's not like even our public health nurses are not paid out of a personnel line that we would have.
Right.
So.
So, I mean, then there's contractual, I mean,
I think I'm gonna just abstain. I'm not gonna vote because I don't know enough information about it right now to be able to say it needs to be appropriated.
do we have this money already in our,
No, it is like the 9117 where you send an invoice for it and then they send the money.
so that's available, but if we don't use it all, we don't have to use it all, right?
Well, it's what gets appropriated. So like I said, I would need time to look through the budget and have the rest of the health board who don't have these copies weigh in to be able
One
to.
of the big
Would you like me
requests
to
has been like RSV for adults or shingles.
Right.
It wouldn't get a ton, but it would get some.
Mm-hmm.
Let me send out electronically the entire grant contract.
Yeah, I think that would be helpful for the board and for the health nurses to be able to weigh in. And I think it would be important for us to have a conversation as a health board on the feasibility and how does the vaccine portion of this overlap with the HFI grant. And so I want to make sure that we have clean margins between the two of them before we put together a formal vote on this request for appropriation.
And wasn't the reason that we were offered this grant because we were like underserved, or because we had a really poor population? There was a reason the grant was offered, because it wasn't offered to all counties.
I don't remember.
It
It was
seems
kind
like-
of a chaotic time at the time.
Yeah, appreciated, but I think that we, as a board, probably need more information to be able to weigh in on action
And
for
I got
my
a
personal.
huge list of people that needed, vaccines and people that needed to get vaccines and get updated on and stuff. Everybody that they sent a letter out to. Well, but then the schools say that they're all up to date. So I don't know where all these kids got their vaccines at and how they all got up to date. Because it was a huge
Usually the
list.
schools are pretty good about
Yeah.
keeping good records.
Well, it should all be running through CHIRP.
Yeah.
So,
Well, the schools have access to CHIRP, right? Isn't that where they get their records from?
North Central Park has traditionally been pretty darn good about it,
Audra usually does good.
because they literally will send them home if they don't have them by a certain day.
I
I
can tell you,
know for Riverton Park, most of our vaccinations are done on the professional mobile bus. If the children don't have their vaccinations, the parents fill out the paperwork and
I
they
didn't know that was still running.
get them there.
And usually Amy Clarkson's really good and Christy are really good about keeping those records up to date. So in regards to this appropriation, I just don't feel as the health board that we have enough information to be able to action on appropriation and not understanding the budget lines and how does that, like I said, I want to make sure we have clean margins between the work that we have and the appropriation for HFI and this. So if you could just send that out electronically to the group, then that'll allow us to be able to review and weigh in. And Angela has a lot of knowledge, from being family medicine and expertise in some of the work that they do through Valley, So I don't know, like in the context of the grant, if there's partnership opportunity. I don't know. So,
It will be Monday before I send out my things.
okay.
as we're
She said it
close
would be
tomorrow.
Monday before she sent that out. Veterans Day for you guys.
Thank the Lord.
My last item is just a note that Angela's board term expires the end of this year.
We gotta get that fixed.
Well, if she's doing another term, it's just a matter of some paperwork, so.
Angela, are you interested in re-upping your board term?
I suppose if you'll have me.
Yeah.
Yay!
Okay.
No backing out now.
Do we need to have a motion on Angela's re-up for membership on behalf of the health board?
Usually you submit something to the commissioners, don't you?
I was gonna say,
Yeah,
I don't
usually
think, I
it's
think
just
it's just submitted
paperwork
to
that
the
gets submitted.
commissioners
Okay,
as a recommendation.
okay.
I mean, if we need one, I can make a motion. I mean, that's not
Well-
a big deal.
And I second, so.
Okay.
Anything else, Janet?
That's it.
Angela or Mary Jo, do you have anything on the phone for new business?
Not that I can think of at the moment. Obviously, a lot of this, budget stuff is very complex, and like you said, we're still kind of learning the ropes and trying to figure out how to get everything a little more streamlined. But if there's anything I can help with, let me know.
Perfect, thank you so much. Mary Jo?
I don't have anything, and I totally agree with what Angela said.
Okay.
Saying I can help with whatever.
All right, Patty? All right, can I have a motion to adjourn this meeting?
So moved.
All right, second?
Second.
All right, all in favor? Aye.
Aye.
Okay, all right, everybody have a good evening and a happy Thanksgiving.